myth. Besides myth, we also look into the misinformation surrounding the COVID-19 and its vaccination. My name is Dako Tsunami, and this morning our topic or the focus is barely basically on the health sector with we're going to be reviewing challenges of primary health care in promoting COVID-19 vaccination this morning. We understand the COVID-19 pandemic has had serious health and socio-economic impacts on the people all over the world, and vaccination is an important, it is also a preventive measure against the coronavirus disease and pandemic. There are, however, reservations about the vaccine resulting from misinformation and disinformation linked to the vaccines. These are areas we're going to be looking at today as our focus, as I stated earlier, was basically on challenges of the primary health care in promoting COVID-19 vaccination. Before we get into the conversation proper with the concerns around vaccine safety and some uncertainties, the shelf life of COVID-19 vaccines and measures to mitigate these challenges, we'll take a message from our partners. And when we get back, we're going to help you with an update, because it appears lots of people, lots of Nigerians really don't believe it exists, or nor would they say they really have taken the vaccine or the vaccination. We're going to dissolve these myths and doubts surrounding the vaccination. We're giving you updates, all right, figures and statistics with states that have recorded several cases of the COVID-19. We go on this quick break. When we get back, we get into the conversation with Dr. Uliagba Fusi Placide Namdi, his guest today on the show. My name is Dako Tsunami. Good morning.
Okay, Mary. Who are you quarreling with?
It's my wife. Oh, she's been pushing that we should get COVID-19 vaccination.
What? You mean you've not taken the vaccine yet?
Me? No, with all those rumors and stories about it.
Papa Berry, government will not bring a vaccine that will harm our citizens.
You're right. Come to think of it, my wife told me that you and your husband have taken the vaccine. Did you experience any side effects?
None at all. You know, our body systems are different. Many people don't experience any side effects. Only a few may experience mild fever, pain at the site of injection, and general body pain, but they usually don't last.
Oh, really?
Papa Berry, the important thing is that the vaccine will protect you, your family, and people around you from COVID-19. It will also stop the spread of the virus.
Amanda, you mean this vaccine is safe, and by taking it, we will be protecting ourselves and others?
Yes, the vaccine is for the good of everybody, and thousands of people have already taken it.
Oh, thank you, Amanda. My wife and I will get vaccinated today.
COVID-19 vaccine is free, safe, and effective. Take it now to protect yourself and others. Also remember to wash your hands, wear your face mask, and observe physical distance.
This message is from National Orientation Agency with support from UNICEF.
What are you waiting for? What are you waiting for? Yeah, yeah. What are you waiting for? What are you waiting for? Millions of Nigerians have received COVID-19 vaccine. I have taken my own. What about you? We have taken our own. What about you? I am strong and healthy. What are you waiting for? What are you waiting for? We are strong and healthy. What are you waiting for? What are you waiting for? Go get, go and get your job. The hospitals, churches, and the mosques. Go and get your job. Center, hurry up now, don't be late. Go and get your job. Bye bye Corona, bye bye Corona, get your job. Bye bye Corona, bye bye Corona. Yeah, be careful Nigerians, we have come to the end of the matter. Stay safe against Corona. Hurry up now, make haste now. Ensure you get vaccinated. You're up to 18, go get vaccinated. Use Pfizer, Moderna, AstraZeneca, Johnson & Johnson. Go, let's go now. Go get your job. Go, let's go now. Go get your job. Go and get your job. Go and get your job. Bye Corona. Bye bye Corona. Get your job. Bye bye Corona. This message is brought to you by the National Primary Healthcare Development Agency, NPHCDA.
All right, welcome back. It is the COVID Talks right here on Omega 101.7 FM, Matt Radio's your radio. And this week we're looking into challenges of primary health care in promoting COVID-19 vaccination. And my guest is Dr. Uliagba Fusi Placid Namdi. He is a director, disease control and immunization, Anambra State Primary Healthcare Development Agency here in Oka, Anambra State. So we're going to get connected with him this morning, even as he tells us their key challenges. But working with recent figures, I'm going to help us with some basic highlights from 13th August to 15th August 2022. And that's what our focus is going to be on. We have talking about the highlights from 13th August to 15th August 2022, 144 new confirmed cases were recorded in Nigeria. And looking through this highlights, to date, we have 22 million rather 626,064 cases have been confirmed, and these cases have also been discharged. So let's get across to our guest. A very good morning to you, sir. Good morning to you, sir. Can you hear me? Okay, go ahead. I can hear you.
Yeah.
Good morning to you.
Okay, tell me once that I didn't hear initially.
Okay, I said this morning we're looking into challenges of primary health care in promoting COVID-19 vaccination. What are the key challenges? Before you came on board, I talked about some basic highlights. From 13th August to 15th August, 144 new confirmed cases were recorded in Nigeria. As at Thursday, 10:40 a.m. yesterday, August 25, we have 262,748 confirmed cases, 3,083 active cases, 256,518 discharged cases, and 3,147 deaths. Now, looking through COVID-19, the National Primary Healthcare Development Agency has also advised Nigerians to protect themselves. Over to you, Dr. Namdi. Let's talk about the challenges of the primary healthcare in promoting COVID-19 vaccination. Over to you, Doctor.
All right, thank you. Good morning to everybody. Yes, I thank God you are giving this data on your own, not necessarily from us, because it is something in the public domain.
Yes.
And that is why we have been saying, people are saying there is no COVID, this and that. We are telling them the thing is there. It's killing people, it's spreading. And we Nigerians, we should know that it is there and we should get ourselves vaccinated. After challenges at the primary health centers, number one is the refusal of our people to accept that COVID-19 is a reality. Many Nigerians, not Anambra alone, but more widespread in the southeast, believe COVID-19 is not there and therefore there's no need for vaccination. That's problem number one. Problem number two is that there is this widespread social media rumors, false information, giving all manner of. Some people will say if you take the vaccine, you will die in 2 years. Some people say the vaccine is meant to stop our population from increasing, all manner of falsehood. Some said you will not, if you're a young lady or if you're in the childbearing age, you may not conceive. Some said some men will not be able to get their wives pregnant in future. These are issues that are not truth. So I'm talking about where people are taking the vaccine and died and all those things. So these are part of the challenges. All our efforts are being thwarted by some of these social media falsehoods. Another one is in some areas, you have this native belief that they don't take English medicine, they don't need vaccination. They have a way of treating themselves when they are sick. This is a falsehood. Because you cannot treat what you don't know, and you cannot protect yourself against what you don't know. Some are saying the drugs were fake, therefore it doesn't work. So these are challenges. Some are even saying, why should we, if you take vaccine, why should you get infected again? But we tell them the vaccination is to prevent progression of the disease when it comes in contact with you. These are the basic things that are happening in the PSCs. There are some of them again that goes down to talk about the manpower ability to reach all.
Okay.
Willing to accept the vaccines, and that has been our major challenge. And that's why we are going from place to place now, going to markets, go to parks. Even as we're having a Ghost meeting, people are going, our teams are going to where people are holding the meeting to vaccinate them. But now these are some of the challenges we are facing. All right.
All right. Thank you very much, Dr. Ulia. Apparently, you have highlighted most of your basic concerns and challenges. But before we get into vaccine hesitancy and how ways which you can foster vaccine confidence, let's also look around some concerns around vaccine safety and the uncertainties. We understand lots of people have various myths, which you have also described as social media has really not fared well with regards to delivering the right message or messages to the people. Also, I want to find out the shelf life of the COVID-19 vaccines. Let's get into that.
The shelf life depends on the manufacturer and the time it gets to us, but every one of them has expiring dates. So it depends on when the vaccine is manufactured and when it gets to us. We have shelf life based on storage too. There are some of them that when they are brought and are kept in that cold system, are supposed to keep them frozen, they will stay for 3, 4, 5, 6 months or more than that, depending on the manufacturer's specification. Some of them, once you bring them, once you thaw them, what we call thaw them, once the frozen nature has gone, they have 30 days interval. Thereafter, they will expire. So the shelf life depends on the state of the vaccine. Is it the frozen one? Is it the third one? That's the one where the third, the one that has been unfrozen somehow. So these are what determines the shelf life. But for every vaccine, like any other drug, any other such medical intervention, the manufacturer specifies the shelf life. It's not something we can pick on our own. So whatever the manufacturer says is what we take as the shelf life. Okay.
Okay.
And then we tell you conditions. And where, like I told you now, if it's frozen, how many months it will stay? If you're frozen it, how many months it will stay? From what we have been doing, all those ones that were frozen is 30 days from the day it was brought out of the frozen state. We call it 30 days. And so most of the vaccines we take to our facilities, once they're unfrozen, is 30 days. If they're not unfrozen, they may stay up to 2, 3 months, depending on what the manufacturer said is the frozen life, is the shelf life, and the time frame between the manufacturer and arriving in Nigeria and all those cold shell system maintenance and storage way.
Okay.
Right.
Okay. All right. It's COVID Talks right here on Omega 101.7 FM. And Matt Radio's your radio. I've been speaking with Dr. Ulia Bafusi Placid Namdi, Director, Disease Control and Immunization at Anambra State Primary Healthcare Development Agency in Oka. And today we're looking into challenges of primary healthcare in promoting COVID-19 vaccination. The phone lines are open. It's 0815 1017 777 0815 107 777. We'll go on a quick break, get a message from our partners, and then when we get back, we'll look into measures or strategies for addressing COVID-19 vaccine misinformation and, of course, measures to mitigate these challenges. So, Dr. Ulia, stay on the other side. We go on this quick break. When we get back, the conversation continues.
Now who you dey quarrel with?
No be my wife. She no wan allow me rest with this COVID-19 vaccine.
Oh, you never still go take am?
Me? No. Mama, with all this story, we don't know which one be true.
Government no go bring vaccine wey no good for you people.
Now do you talk? But to come home, my wife say you and your husband don't take am. He don't do una anything.
No, he don't do us anything. But every person body no be the same. Many people wey don't take am no get any wahala. But some few people fit get fever, body pain for where they give them the vaccine. But e dey small and e no dey last.
That will not be problem now.
The important thing be say the vaccine na to protect you, your family, and people around you from COVID-19 and to stop the spread of the virus.
Mama Ada, so if we take this vaccine now, we go dey safe and we go protect others too?
Yes, the vaccine na for the good of everybody and plenty people don't take am.
Thank you, Mama Ada. Me and my wife go take the vaccine now.
COVID-19 vaccine now free. It is safe and effective. Take them now to protect yourself and others. Also remember to wash your hands, wear face mask, and observe physical distance.
This message now from National Orientation Agency with support from UNICEF.
All right, welcome back. If you're just joining, it's Omega 11.7 FM, and Mart Radio is your radio, and it's the COVID talks. Right here, we're looking at the challenges of primary healthcare in promoting COVID-19 vaccination. And I said something about some highlights from 13th August to the 15th of August. 144 new confirmed cases were recorded in Nigeria. I'll help you with the states. From Lagos, it was 101. In Abia, it was 13. In Akwa Ibom, it was 10. In the FCT, it was 9. In Kano State, it was 5. In Kaduna, it was 3. Bauchi had 1. Ekiti had 1. Plateau had 1. The latest report also. The confirmed cases has been 262,748. Active, 3,083. Discharge, 256,518. So the fact that you don't know anyone doesn't mean there's not been cases confirmed, active, and discharge. And death has been 3,147. Now, over to you, Dr. Ulia, on the other side. Let's talk about strategies for addressing COVID-19 misinformation and also vaccine hesitancy and ways to foster vaccine confidence. Over to you, sir. Hello?
Hello?
Yeah, I can hear you. Over to you. Let's get into the strategies for addressing the COVID-19 vaccine misinformation and ways to also foster vaccine confidence.
Yes, in terms of misinformation, we have engaged the public in what we call advocacy and group focused advocacy and group discussions and community meetings where we engage different groups, market women, traders, auto park workers, Okada riders. We talk to them, we explain to them, we get them to understand that the vaccine is safe. And we could not giving them instance about since 2001, March, when we started the vaccination. There has not been any untoward story of adverse reaction. Nothing has happened. And some of us use ourselves as examples. We took it in our various communities, in our various workplaces, and posted it to the social media. You can see it. We call it draw information from abroad. The people they post that this is what they are doing. They are vaccinating their people. Nothing untoward reaction. That is one. Then on the social media, they want to call infodemic. Dealing on information on some of these countering some of this information. Once we get them, we analyze it. We analyze the source. We look into it. We now come out with something to counter it. Radio talks, TV talks, and like we're talking now, we're using them to talk to some of them, explain to them, to the public, the safety and how safe the vaccine is. So we have been using those methods. I've been reaching them through group discussions, visits, radio, TV talks, newspaper publication where possible. When we are doing anything, this time we did scale 3.0 flag off. We use that opportunity to talk to the press. We do our press briefing and then we talk to them. We explain to them. We ask them to help us move information to the communities. And different radio stations and TV stations have been engaged by our partners, WHO, UNICEF, and the different national in talking, spreading the news, how safe and how effective the vaccine has been. We also do what we call calls, sponsored by UNICEF, where we make calls to the people who have taken first dose, we give them calls. You have any problem, come and take your second dose or come and take your booster dose. But using that, have any challenge, let us know. So we have been doing that. At the PSC, we also give them talks as they're coming for the vaccine. We explain to you, give you that confidence that nothing happens, it's okay. So we have been doing that. And that has actually been addressing the vaccine resistancy because of recent, there has been an increase in number of people taking the vaccine in Anambra, unlike sometime last year, at the beginning of the whole process. We really encourage health workers that for you to go into equity, you must come with clearance.
True.
You have to take the vaccine before you convince any other person. And majority of them are taking it. So there have been improvements. So we have been talking about it, we have been going about it, and it has been yielding positive results.
Quite interesting and commendable, but then we understand that it's not over. You know, someone said it's not over until you win. So we're still on the talk. We'll keep saying it. It's going to sound like a nursery recital, but we don't mind because vaccination is an important preventive measure against the coronavirus disease. I think there's someone on the other side. Let's find out if we can take a call and proceed this morning. Hello?
Hello, good morning.
A very good morning to you.
Yeah, my name is Jim Enugu.
Okay.
Yeah, may I ask the doctor? Let him clear the air because he thinks there is a contradiction there.
Okay.
He said that it is vaccination prevents, but we know what he has about the president of America. He concluded the everything about that COVID was the 3 rounds. At the end of it, he got reinfected with it.
Okay. Okay.
Clear that. And if vaccination does not prevent reinfection or infection in the first place, why do we have to do it? Why do we not continue with the face mask and the distancing and the hand washing? What is the place of
the vaccination? Okay. All right. Thank you so much. Let's actually reach out to Dr. Nandi. Possibly he will give a response to that question this morning. And to you, Dr. Nandi, what his question was, he cited the President of America, how that he had been vaccinated, yet he got the virus yet again. So can you be reinfected? One, that was the first question. And he said, why don't we maintain social distancing, washing, and the nose masks? Why get the vaccination or why get vaccinated? Over to you, sir.
All right. The work of any vaccine is to get your body prepared in case you come in contact with the disease. Your body defense has been built already, and they will now prevent the disease from progressing. That is the work of vaccine. Vaccine didn't say you get it, that disease may not come to you. But if by chance you get infected again, your body will defend it straight away. it won't progress. It won't go beyond that point, and you'll be healthy enough. The American president, who compared with when this immediate past prime minister of UK had the infection initially, you know, he was sent into ICU and co. But now, this is where you get it, it doesn't progress. You just have the feeling I have something, and they will do the same, but the body will not progress. That is the essence of vaccine. Anywhere, anytime. That is vaccine. Then the issue of social distance, keeping the distance, physical distancing.
The nose masks and yes.
Nose masks. In advanced world, where they have gotten up to more than, so have gotten up to 75, 80, 90% vaccination of their communities, which will go there to increase what we call herd immunity, which means those people who have gotten up to 80 or 90%, if you got 80% percent of the whole country, it then means that for every 100 people you see, only about 20 have not gotten vaccinated. And even if the infection comes in, you find that it's going to, the infection will meet people who are resistant to the disease. It will not progress.
Okay.
So, and those are the people who said they should remove face masks and those things. And even in the years recent, when the immediate past prime minister of Britain had a party, you know, it came under fire.
Yes.
For the UK public, why should you hold such party of that number of people without using the face masks?
Yes.
Now was when he quickly announced that the face, you can now go without face masks and things like that. So the issue of face masks, well, I believe so. Nigerians, would they agree? So physical distance, we won't agree. Not more than 20 people to a party, we won't agree.
Okay.
Face masks, we really fight with people when they come to certain establishments. There are some establishments that have said you must have your face mask before you enter. You need to be in short banks and you see how they fight, where people want to break down the doors. That is our problem.
All right.
So that physical distancing, we're supposed to maintain it. But since it wasn't easy for us, they now say, since some people have, if you are getting vaccinated, you are free, you can go about without the nose mask, and because once the infection gets into your body, will repel it.
Okay.
But for the person who has not gotten vaccinated, you stand the risk. If it gets into you, your body may not withstand the pressure.
All right. Thank you so much for doing this with us yet again. Thank you for educating us on your key challenges and, of course, concerns around vaccine safety and uncertainties. Thank you so much and have a good weekend.
Thank you.
You're welcome. All right. So that's how far and how much we can go on our COVID talks today. It makes a return next week, Friday. Good morning.